Today we're going to be talking about Medicare, Medicaid, and the Children's Health Insurance Program, which are federal social insurance programs. So we're going to briefly touch on Medicare and then mostly look at Medicaid and CHIP, or the Children's Health Insurance Program. So, like I mentioned, these are federal social insurance programs, and the oversight comes from the Centers for Medicare and Medicaid within CMS. Looking at Medicare, this is a program with very minimal state involvement. It was signed into law in 1965 for citizens 65 and older. They meet certain federal disability criteria. This is all federal funds. So at the state level, we don't talk about it very much, but there are 64.5 million people who received health coverage through Medicare in 2022. So it is a large national population. What we talk about more on the state level are these state managed programs. So the bigger of the two, Medicaid, this is for people with low income. So you must meet a certain income threshold in order to be eligible for the program. It was also began in 1965 and is funded in part by state and federal government. There are two specific populations that we talk about. There's the traditional population, which has been kind of that long-standing Medicaid population that was formed when the program was formed. But there's also the expansion population, which came into effect in 2010 nationally with the Affordable Care Act. But then 2016 is when it was adopted by Montana, and we brought in these populations to our own enrollment. And then on the other side of things, there's CHIP. This was began by the federal government in 1997 by the Balanced Budget Act. And like Medicaid, it's a joint partnership between the state and the federal government in an effort to provide insurance for lower income children. And this expands the coverage of insurance for children 0 to 18 who don't meet the income limitations of Medicaid, but are still below 261% of the federal poverty level. So this is kind of a guide of where we're going with this presentation. We're gonna take a deeper dive into that traditional portion, and then my colleague Adam is gonna speak to expanded Medicaid and the Children's Health Insurance Program. So before we do that, just taking a look at some of the federal poverty level guidelines. These are what we're talking about when we're discussing income thresholds. So these income thresholds are put out by the federal government. This particular chart is showing fiscal year 2024 guidelines, but it is important to note that these change year over year based on the cost of living. And it's also based on family size. So you can see to the left is the number of people in each household. For a person of one, 100% of the federal poverty level is going to be that $15,060. So that's the annual household income for that individual. Up to a family of four, that household would have to make $31,000, $31,200 or less to fall within this particular threshold. So going a little bit deeper into that traditional Medicaid, we've got a few different populations that we talk about when we're looking at traditional. The first is children, and for children, their parents must be making less than 143% of the federal poverty level to be eligible for Medicaid. And that is matched at the standard federal medical assistance percentage rate for the state of Montana, which we'll talk about a little bit more in the next slide. But basically what this means is that for every 38 cents that the state puts up, the federal government will put up another 62 cents that goes into the Montana budget for Medicaid. The two kind of other main populations within traditional are the aged. So these are individuals who are 65 and older and who meet certain asset or income tests. And then also blind and disabled individuals as well. They must meet certain Social Security criteria, and then also meet those asset and income tests as well. And again, these two populations are reimbursed at that standard federal medical assistance percentage. And then there are a few other populations that fall under this, and that match varies depending on the population. So the major population I think we're talking about within this category is Indian Health Services, and that is a 100% federal government funded area of this program. So anything that goes to Indian Health Services is federal funding. Also within this population are pregnant women. So pregnant women are eligible for Medicaid if they earn up to 157% of the federal poverty level, and they're reimbursed at the standard match rate. And then there are certain waivers that are reimbursed a little bit more than the standard rate as well that fall into this population. So looking at the FMAP in particular and a few more details on that, here we have a chart of the fiscal year 2024 FMAP for Montana, which is 63.91%. And as you can see, relative to other states, I mean, we're kind of in the middle, but Montana in general has been trending down in the most recent years. This federal medical assistance percentage is calculated each year, and it compares the state per capita income relative to the national average. So as Montana's per capita income is increasing, we have seen that FMAP going down. And there are some statutory limitations on this, so we can't just go all the way down to zero. It is capped at a 50% federal and a 50% state share. But right now, as of fiscal year 25, again, this is a little bit older of a graph, but as of fiscal year 2025, we're at 62.37% for our FMAP. So again, just to reiterate what that means is that for every 38 cents about spent by Montana, the federal government pitches in another 62 cents to make up that full dollar. Each program varies by state. So within state Medicaid programs, there are certain mandatory services that states must provide. These include some of the bigger ones, including hospital services, both inpatient and outpatient, federally qualified health centers, nursing facilities, and the list goes on. But the states can choose certain optional services as well. So some of the examples right here are the optional services that Montana provides to the Medicaid enrollees. So these include things like outpatient drugs is a large one, dental, home and community-based services as well. Things like that, the states don't have to provide, but Montana has chosen to provide. The Medicaid programs among states also vary based on waivers, and we're not going to go super deep into this. We do have a brochure on that library that I showed before, but we have the ability as a state to apply for certain waivers to waive federal Medicaid requirements from CMS. And Montana has several different waivers, and that customizes the program to different populations. So some of the federal requirements that we talk about when we're looking at waivers include comparability of services. So the same amount, duration, and scope of services need to be provided to every enrollee. Things like freedom of choice, so the choice of providers participating in the program. You have to be able to go to any of them. And then statewide-ness, you can't exclude because of where they are in the state or the type of population that they are. And so these waivers allow to add on services or demonstrate that maybe a program would be of cost savings to the state by waiving one of these requirements. So a lot of material on that, again, on the library, direct you to there. but just one more way that states can vary their program. And then finally, our last slide here pertaining to traditional, pointing out the general proportion of enrollment to expenditure by major aid categories. Now, this is a fiscal year 2021 graphic that was provided by DPHHS in the Medicaid in Montana report, but it is quite an instructive one to see what the proportion of populations are compared to the relative cost that they bring into the state program. So that brown large column in enrollment, that 64% being children, here in 2021, they are the largest enrollment category, but when you compare that to the proportion of expenditures within this year, it's a pretty small proportion of the cost, versus if you look at that green and that blue bar with the blind and disabled populations and then the aged populations, though they're a relatively small portion of enrollment, they are a fairly large portion of the cost as well. So with that, I'm going to pass it on to my colleague, Adam, to finish us out.
Thanks, Julia. So yeah, we're going to move on from traditional Medicaid to its sister program, Medicaid expansion. This program provides healthcare to able-bodied adults ages 19 to 64 who meet certain income requirements. Like traditional Medicaid, expansion is a state and federal partnership. However, it is not mandatory, as each state can elect to participate independently. To date, 40 states, as well as the District of Columbia, have adopted the program. 10 states still have not done so. Next slide, please. Let's take a look now at the history of expansion in Montana by starting in 2010 with the passage of the Affordable Care Act. The ACA, among other changes it made to our nation's healthcare system, created the expanded Medicaid program, which again allowed states to opt in to providing expanded Medicaid. The first states to adopt expansion did so beginning in 2014, and in 2015, the Montana Legislature passed the HELP Act to establish our Medicaid expansion program. The original bill set a program sunset date of June 30th, 2019. But before that could happen, the 2019 legislature renewed the program for another 6 years until June 30th, 2025. Legislators will have the opportunity to, during the upcoming 2025 legislative session, to look at the merits of either allowing the program to sunset as outlined in HB 658 or to extend it once again. Next slide, please. And as I mentioned, Medicaid expansion was renewed in the 2019 session with a current sunset date of June 30th, 2025. Upon the 2019 renewal, the legislature created some state special revenue funds, which went into effect in state fiscal year 2020. Now, with 3 funding sources between the general fund, the federal funds, and the state special funds, expenditures for expansion's Medicaid benefits and claims have risen from around $800 million in fiscal year 2020 to just over $1 billion in fiscal year 2023. Due to the program's FMAP of 90%, Montana's portion of these expenditures in 2023 was $93.5 million, compared to almost $930 million from the federal match. Yes, next slide, please. Thank you. The 2 main state special funds are the hospital utilization fees, which provide 51.9% of the expansion expenditures, and then specially allocated HELP Act funds provide another 45%. These include Health Service Corporation fees and taxpayer integrity fees. The Montana Healing and Ending Addiction Through Recovery and Treatment, or HART program, which receives its funding from marijuana tax revenues, contributes 3.1% of expansion's state special revenue appropriation. Before talking about Medicaid expansion enrollment, allow me to briefly highlight the program's eligibility criteria. In a nutshell, low-income adults ages 19 to 64 can qualify if their gross income is less than 138% of the federal poverty level, or FPL. This year, that means a single person making less than $20,783 can qualify for expanded Medicaid coverage, and a family of 4 must make less than $43,056. So, how many people are taking advantage of Montana's Medicaid program? At its outset, 42,000 people signed on in 2016, and after some ebbs and flows over the ensuing years, which mostly tracked the economy at large, meaning as the economy struggled, more people enrolled, and vice versa. Enrollment now sits at around 79,000 people, slightly below the pre pandemic levels. Taking a look now at the historical enrollment trends will give us some more context for this. For instance, we see that traditional enrollment was fairly steady upon the introduction of expansion, and then expansion's enrollment steadily increased during its first 3 years. But then enrollment in both programs began to decline around 2019. Then COVID happened, and with it, the federal government put a temporary stop to the eligibility redetermination of anyone on either program. This resulted in a steep enrollment increase during the pandemic beginning in 2020 and ending in the first half of 2023 when redetermination was allowed again. Now, after over a year of reviewing participants' eligibility, enrollment numbers are back to pre pandemic levels. And then here is where enrollment stood in July of this year. Between the state's two Medicaid programs, several distinct populations are served, as Julia already mentioned, including the blind and disabled, the aged, children, and other adults. This slide delineates between the traditional and expansion, as well as adults and children. So in July, around 208,000 people were covered by the program, including approximately 100,000 children. And then state offered healthcare for children, commonly known as CHIP, is here in Montana as well, but we call it Healthy Montana Kids. The program offers expanded eligibility, which is meant to cover children whose families are not eligible for Medicaid, but have incomes too low to afford private insurance. As the slide indicates, children whose families make less than 143% of the FPL will qualify for traditional Medicaid. But children with families' income ranging from 143% to 261% of FPL are CHIP eligible and then can be covered up until the age of 19 with a free or even low cost plan. Covered services in the CHIP programs include medical, dental, vision, and other related services. And then, as this slide indicates, the federal matching rate for CHIP is higher than traditional Medicaid's FMAP. Generally, it's around 11.5% higher, and it's known as the Enhanced FMAP or EFMAP. This was extended to continue through September 30th, 2027. Although Montana is not close to the threshold, the Enhanced FMAP is capped at 85%. And a stipulation of receiving these federal funds is the maintenance of effort principle. States must maintain eligibility standards, methodologies, and procedures for children that are no more restrictive than those that were in effect on March 30th, 2010. As we look at the funding of Healthy Montana Kids, General Fund has stayed steady for the past several years, with increasing state special and federal funding staying relatively constant as well. The state special funds tied to HMK include the CHIP Tobacco Settlement Fund and the Healthy Montana Kids Plan State Special, which comes from the insurance fees. And then the last thing we want to cover today is the potential funding risk for Medicaid programs. So far, the feds have kept their word in maintaining Medicaid expansion's FMAP at 90%, but things in DC are always changing, and we wanted to cover what may happen if they alter Medicaid in any way. The most likely impetus for a change would be the need for the federal government to reduce its federal budget deficit. This would result in one of three likely scenarios. The first being across the board cuts, and that would result in about a 10% reduction to each federal program. In fiscal year 2018, Montana received just over $3 billion in federal grants, of which 1.6 billion was Medicaid. A 10% reduction in this amount would result in about $310 million fewer federal grant money annually. So that's an amount that would increase over time. Of course, it is unlikely that the state would backfill this entire amount with state funds. Some programs would simply lapse or offer fewer services. Another option for the feds would be following the Congressional Budget Office's proposal titled Options for Reducing the Deficit 2019 to 2028. Among this list of potential spending reductions is reducing many of the high dollar items related to Medicaid, such as establishing caps on federal spending on Medicaid, or limiting states' taxes on healthcare providers, or even reducing federal Medicaid matching rates. And then the last scenario we'll go over is the Budget Control Act of 2011. Now, this established the sequester mechanism that caps federal spending. So this is a bipartisan, there's also a bipartisan Budget Act of 2013, which made some changes to the Budget Control Act. This package of legislation aims to decrease the rate of increase in federal spending. It applies spending reductions to defense and non-defense programs in equal amounts. So the Budget Control Act exempts Medicaid as well as most other entitlements and some highway spending. So its impact on states is minimal compared to other federal deficit reduction plans. But the BCA and the BBA were bipartisan efforts. So it is certainly worth considering their structure if one anticipates future bipartisan efforts to reduce federal deficits. So that is our coverage of Medicaid and its related programs for today in Montana. We are certainly available for questions if there are any at this time.